Did you know that up to 80% of medical claims contain errors? In the healthcare world, these mistakes can turn into claim denials and they lead to delayed reimbursements. When left unchecked, these errors can create a bottleneck in your revenue cycle, causing delays that can drag on for weeks or even months. This is why having a streamlined revenue cycle management, or RCM system, is essential for healthcare organizations. RCM is the lifeline of any healthcare provider, ensuring payments come in smoothly and promptly for the services you provide. Without a strong RCM, these denial claims can pile up, draining both time and resources. Having a proactive approach, training your team to avoid these common errors, can help prevent these issues before they arise. It saves you from having to clean up an otherwise avoidable mess and can even help increase your bottom line. Billing practices differ depending on the type of provider. For instance, hospitals and large institutions bill differently than individual providers like primary care doctors or dentists. Failing to understand these differences can lead to revenue loss and delayed payments. In fact, a recent study estimated that errors in hospital billing alone cost the industry around $68 billion annually. One area where these differences become critical is in the use of billing forms. Today we're going to look at two important billing forms, the UB-04 and the CMS 1500. We'll explore how they work, who should use them, and why choosing the right one is crucial for getting paid on time. First, let's talk about the UB-04 form, also known as CMS 1450. This form is primarily used by institutional healthcare providers like hospitals, nursing homes, rehabilitation centers, and hospice facilities. The UB-04 form is used to submit claims for services provided in these types of institutions. UB-0 forms allow providers to submit detailed information on services rendered, including patient and provider details. This ensures that payers such as insurance companies have all the necessary information to process claims promptly. Initially developed by the Centers for Medicare and Medicaid Services, or CMS, the UB-04 form is now widely accepted by insurance companies for institutional claims. Now let's compare this to the CMS 1500 form. This form is also a CMS-developed billing form, and like the UB-04, it includes information about patient, provider, and services provided. However, the CMS 1500 form is tailored to individual healthcare providers such as physicians, therapists, dentists, nurse practitioners, and midwives. So when should you use each form? Here are some examples. Use the UB-04 form if you're an institutional provider submitting claims for inpatient hospital stays, outpatient surgeries, rehabilitation services, room and board charges, or medical equipment in an inpatient setting. Use the CMS 1500 form if you're an individual provider and need to submit claims for office visits or outpatient procedures, diagnostic tests, services outside of an institutional setting where diagnosis and procedure codes are required. Choosing the right form is just the first step. Make sure your team understands these differences and double-check claims for accuracy before submitting. If you're unsure about which form to use, consult a supervisor or even check with the insurance payer. This attention to detail can save you time and prevent denials in your revenue cycle. With the right processes in place, you can reduce the risk of errors and keep your revenue cycle running smoothly. If you'd like to learn more about healthcare billing, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.